Welcome to the PowerPoint slides on mental disorders. When someone is diagnosed as having a mental disorder, it means that their behavior is maladaptive, it's socially unacceptable, it's disturbing. In other words, the behavior is not just different or eccentric or unique. They're actively causing problems either for themselves or for other people. And throughout the history of psychology, there have been a variety of different perspectives on what the underlying cause of mental disorders can be. Depending upon the perspective you start with, mental disorders can be thought of as stemming from different causes. If you use the psychodynamic model, the assumption is that mental illness happens when your defense mechanisms begin to break down. They're no longer effective at helping you manage your levels of anxiety. And this anxiety is the result of conflicts, unconscious conflicts between your ego, your id, things that you're completely unaware of. Remember in the last module in the course when we talked about Freud and his theories. If you adhere to the medical model, you assume that mental disorders are caused by abnormalities of the brain and the nervous system. In other words, there's some sort of breakdown in brain chemistry or some sort of structural problem with the brain itself. The medical model is probably the dominant way of thinking about mental illness today. If you're coming at mental illness from a cognitive or behavioral perspective, you assume that people have simply learned maladaptive patterns of behavior, or they have irrational, faulty beliefs, and these are the things that are the source of their troublesome behavior. Humanistic psychologists believe that mental illness can be traced to the fact that people are unhappy with the kind of person they've become. They're very oversensitive to the expectations and criticisms of other people. There's a gap between the kind of person they want to be and the kind of person that they perceive they are. So humanistic psychologists believe that it's this gap between the ideal and the actual that causes tension and unhappiness for people. According to the sociocultural model, abnormal behavior or mental illness is essentially a mismatch between what your culture expects and what the rules of behavior are in your culture and what you're actually doing. So, for example, there have been many places in the past where, for example, if somebody didn't believe in God, they were considered to be insane because only an insane person would have that perspective according to the culture that they were in. Or in the old Soviet Union, people used to be put in mental hospitals if they doubted that communism was the best way to organize the society. So sometimes if you're just out of step with your culture, you can be described as mentally ill. The diathesis stress model proposes that some individuals have genetic predispositions that make it more likely for them to become mentally ill at some point in their life. But this may or may not happen. It will only happen, according to this model, if they experience intense stress that exceeds their ability to cope. So, depending on the perspective you've got, mental disorders are coming from different places. And it may be that all of these things are true to some extent and that they all contribute to the experience of mental illness. The Bible for diagnosing mental disorders is something known as the DSM-5. DSM stands for the Diagnostic and Statistical Manual of Mental Disorders, and the 5 indicates that this is the 5th edition of this book. And the book gets fatter and fatter with each new edition. The first and second editions were very thin, almost pamphlet-like. The DSM-5 is a big, fat, heavy book. But the DSM-5 currently has a monopoly as a classification scheme. And because it's most consistent with the medical model, that perspective now dominates in the diagnoses of mental illness. The DSM-5 is based almost entirely on observable behavior. So what you do if you're a therapist trying to diagnose a client is to look at the patterns of behavior go to the DSM-5, see which combinations of behavior are associated with which disorders, and that's the way you do the diagnosis. Traditionally, there have been a couple of different approaches to diagnosing mental disorders: the clinical approach and the actuarial approach. The clinical approach is based very heavily upon the experience of the therapist. The therapist, based on years of work with a variety of clients, will look at the pattern of behavior that they're seeing. They will talk to the client and diagnose the mental illness in accordance with their past experience with clients like this. The actuarial approach, on the other hand, requires that the therapist apply statistical rules to diagnoses that are based on research. So there's a set of criteria. They can be test scores, medical histories, demographic information about the person. But you take these criteria and combine them, and it's almost like a formula. And that formula tells you what the diagnosis should be. So the therapist has much less freedom to subjectively take the diagnosis one direction or another. A little bit of research that's been done on this indicates that the actuarial approach is probably superior, but there are certainly very successful clinicians who depend heavily on the clinical approach, and they think that the actuarial approach is too limiting. It doesn't allow the therapist to take into consideration things that could be very important. I'm not going to take sides on this debate, but I do want you to be aware that people do use different techniques as they're doing diagnoses. As I discuss types of psychological disorders in other PowerPoint presentations, I'm going to be grouping them in a particular way. I'm going to talk about psychoses. When we're talking about a psychosis, we're essentially talking about schizophrenia. An individual suffering from psychosis is completely out of touch with reality. Their thinking is totally disordered. They may be delusional. It can be very difficult to talk to them because their language may not make a lot of sense. The individual may be unaware that there's anything wrong with him or her. And often a person suffering from psychosis is brought to the attention of a therapist by friends and relatives rather than coming in on their own. A person suffering from some sort of neurosis, on the other hand, knows that they have something seriously wrong with them. They're overwhelmed with anxiety. They're fearful. They're unhappy. They're depressed. These people are not happy campers. The strategies that they use for getting through day-to-day life are starting to break down. They're not working well at all. And the person is keenly aware that there's something very wrong with them. I'm also going to talk about mood disorders. Mood disorders don't fit neatly into either psychosis or neurosis categories, so we'll give it a category of its own. When we talk about mood disorders, we'll be talking about things like bipolar disorder and severe depression. And miscellaneous disorders will include a variety of things, such as substance abuse disorders, impulse control disorders, psychosexual disorders, personality disorders, and so forth. So check out the other PowerPoint slides to learn more specific details about these different categories of psychological disorders.